Hello, we are the Lobes, and we are researching Meniere's disease. So what is Meniere's disease? Meniere's disease is an inner ear disorder that is caused by too much fluid buildup in the cochlea and semicircular canals, or also known as the inner ear. This can include episodes of vertigo, tinnitus, and a feeling of fullness, pressure in the ear. In most cases, Meniere's disease only affects one ear, but depending on the severity of the case, it can also spread to both ears. Meniere's disease also gets worse over time, so a patient might be experiencing tinnitus or ringing in the ear, in their right ear, but they can go on with their daily life without it having effect on how they go about their day. And but then over time, it can get to the point where it spreads to both ears, or the ringing becomes so loud that they're staying away from social activities, and it's affecting their daily life. This is also a chronic, incurable disease, so we'll talk about treatments a little bit later, but a lot of the times to get Meniere's disease to go away completely is impossible. So audiologists can help with some of the treating some of the symptoms, but that doesn't include them to disappear.
So individuals who have Meniere's disease may experience symptoms like reoccurring episodes of vertigo. This means that the individual may feel like they are moving when they are not. And it is a spinning or a swaying sensation. They may also experience hearing loss in one or both ears. Individuals may also have ringing in their ears, which is also called tinnitus. And their ears may feel full, and they could experience nausea and vomiting.
So the causes of Meniere's disease are a bit interesting. The first and most important thing to understand is that the main cause of Meniere's isn't exactly known. There's a lot of discussion and debate about what exactly causes this disease, but most often what is cited as the main cause is an excessive amount of fluid or endolymph that builds up within the inner ear. And it can build up in the semicircular canals and the cochlea. So some of the causes that might cause excessive fluid within the inner ears could be a blockage within the inner ear or an anatomical abnormality which causes improper fluid drainage from the inner ear. Also, allergies and viral infections could lead to an excess amount of fluid building up within this part of the ear. A head trauma, falling off a ladder, hitting your head really hard on something could also lead to a large amount of fluid building up. And some other causes like genetic predisposition and migraines are being looked into to see if those might also be a cause of Meniere's disease.
So how common is Meniere's disease? Worldwide incidence of Meniere's disease is approximately 12 out of every 1,000 people. And about 100,000 people develop Meniere's disease every year. And Meniere's disease can develop at any age, but is more likely to happen to adults between 40 and 60 years.
So what are the treatments for Meniere's disease? Like we said a little bit earlier, it's very difficult to treat all of Meniere's disease, but an audiologist as well as an OT can help with these symptoms. A doctor may prescribe motion sickness or anti-nausea medication to help with the symptoms of tinnitus and it having effect on their daily life. Long-term solutions that audiologist or OT might conduct would be vestibular rehabilitation, which is just practicing working on balance, using an eye-head coordination test, being able to make their symptoms less and less. They can also prescribe a hearing aid so that they can hear a little bit better in social instances when they're in group settings or work settings. An audiologist also may prescribe middle ear injections to help with the vertigo. And surgeries can also be performed on more severe cases, including a vestibular nerve section, an endolymphic sac, which pretty much helps control vertigo by decompressing the sac. Like we've already mentioned, the result is unknown as to why there is this extra fluid, but having this endolymphic sac surgery helps absorb the fluid that contains the endolymph. And also a labyrinthectomy. There is no exact cure for Meniere's disease, so these are just treatments to help make the symptoms not as severe.
So now we're going to describe what a case history for someone who has Meniere's disease might look like. This is just an example of Meniere's disease, but it's important to note that this disease is so variable in its symptoms that every case history will probably look a little bit different. Our case looks at a woman named Susie who recently moved from the city to a quiet home in the country. After she moved, she began to hear a strange ringing noise in one ear. It started out as a quiet noise, and then progressively over time, it began to become louder. Susie is 50 years old and lives on her own. She doesn't have many social interactions and does not have anyone to discuss her symptoms with. Susie works from home and doesn't seem to be bothered much by her symptoms. Her symptoms occur somewhat randomly and do not seem to have any effect on her day-to-day activities. Over the course of several years, her symptoms begin to become much worse. The ringing she is experiencing has now transferred to both ears and is accompanied by episodes of vertigo. She is also experiencing a sensation of fullness in both ears, which makes it difficult for her to hear others when she goes to the grocery store, as well as her work-related meetings via Skype. On a particularly bad week, Susie experiences vertigo that inconsistently lasts up to 3 days in a row and seems to be causing her nausea. She decides it's probably best to go to see her doctor. The doctor soon gives her a referral to see an audiologist to receive more in-depth testing of her hearing.
Susie explains her symptoms to her audiologist. She confirms with Jane that she is feeling fullness in her ears, tinnitus, episodes of vertigo, and the fact that she hasn't been able to hear people as clearly. This has been an ongoing but fluctuating problem that has gotten much worse over time. Jane decides she is going to run 3 tests on Susie. She begins with the audiogram to test Susie's air conduction and bone conduction thresholds. She finds that the audiogram shows more severe hearing loss in the low frequencies and mild to moderate hearing loss in the higher frequencies. These results indicate Susie has some sort of sensorineural hearing loss, which goes with why she is experiencing issues with conversation. Dr. Jane then tests acoustic reflexes to see if they are present. She finds that this test shows an absent acoustic reflex. This may be because the inner ear was not able to process the sounds presented, so the brain did not trigger and send a response to contract the stapedius muscle. Next, Jane would like to test her vestibular system to address the vertigo that Susie has been experiencing with the Foucault test. When Susie begins the test by marching 50 steps with her eyes closed, Jane notices that Susie is deviating towards her left side past a 45-degree angle. This indicates that there is a pathology in the vestibular system which is preventing the brain from knowing how to balance. By the results of the Foucault test, Jane is now beginning to suspect that this could be Meniere's disease. To confirm her prediction, Jane would like to examine the V&G test. Testing Susie's eye movement shows the absence of nystagmus, which means there is a dysfunction with the balance system.
So the results that we found for this case study for Susie Her audiologist, Jane, feels confident that it's Meniere's disease. She decides to refer Susie back to her physician to receive a blood work test to rule out any other pathologies. Her audiologist, Jane, suspected Meniere's disease when she noticed the low frequencies were affected before the high frequencies in both air conduction and bone conduction. In most cases, sensory neural hearing loss affects the high frequencies first. Therefore, this stood out to Jane as a specific symptom of Meniere's. The balance test performed also helped confirm this diagnosis by showing that there is some kind of pathology in the inner ear that is showing some sort of dysfunction in the vestibular system. Jane recommended further blood work to exclude any metabolic or immune mediated disease, especially because there are symptoms of bilateral hearing loss. Jane chose to use the acoustic reflex test to confirm that there was a sensory neural hearing loss because it was purely physical test instead of a test that required behavioral response. Like we've kind of already mentioned about the audiogram, this does stand out as sensory neural hearing loss because the gap, the 10 dB gap in here between air conduction and bone conduction. We also know that Susie is experiencing severe case of hearing loss because she is losing her hearing between 50 and 80 dB. This audiogram also stands out, like we've also said, to an audiologist because the low frequencies are affected first. Susie is also experiencing bilateral hearing loss, which means she's just having hearing loss in both the right ear and the left ear. The reason that the lower frequencies are affected first in Meniere's disease is because the pressure increase in the endolymphatic sac affects the fine-tuning functions of the basilar membrane and the outer hair cells. So this is just a kind of audiogram to show the results that we came up with after testing Susie's hearing.
These are the references that we use to research more about Meniere's disease.
Thanks for watching. We appreciate your time. And this is just a little bit more information about Meniere's.